I'll show Dr. Kalpana MURTHY.
Thank you, Dr. Kwon and Dr. Padma and the APO for this invitation. Mine is a slightly offbeat topic on role of lifestyle modifications. And actually, I must admit, I learned a lot after I got this topic. And I'll just share with you some of the facts. So as we saw in all the previous talks, the uveitis is a diverse and a complex disease, and there is a lot of interplay. And there is a disturbance in both the regulator and the effector components. And we all know that this uveitis can be chronic. And as a physician, we not only have to deal with the disease per se and the sequelae, there are a lot of psychological implications. There are a lot of negative emotions these patients come up with, the cost of treatment and the side effects of the drug. Now, if we look at uveitis in India, in the last 2 decades, we are seeing a lot more non-infectious uveitis, and this is probably because of the industrialization. And with industrialization comes a lot of change in the lifestyle factors, and there is a growing body of evidence which shows that there is a role of gut microbiome, the diet, the smoking, physical inactivity, stress, mental health, and even sleep for that matter, which can cause triggers in immune responses. And that applies to uveitis. So as a clinician, one needs to actually have a holistic approach for the overall well-being of our patients. Now, there is a lot of talk on the gut microbiome. So this is a few slides on what exactly are we looking at. Now, earlier ancient texts and Ayurveda, we've always heard that for a good health, it is through your gut. And this is very true because most of the scientific evidences which are coming out now are emphasizing the role of the gut microbiome in autoimmune diseases. So what is this gut microbiome? It is actually a complex bacterial community which resides in the intestine. And basically, it contains about 160 species. And these species can be differentiated into fermentative bacteria, and this is the one which is the anti-inflammatory. And there are pathogenic microbacteria, and these are supposed to be pro-inflammatory. So if you have the anti-inflammatory better than the pro-inflammatory bacteria, then your gut is healthy. So any disruption or imbalance in this is what we call as dysbiosis, and this can disrupt the immune homeostasis, and this can trigger autoimmune diseases. Also, there are what is now being increasingly recognized as the gut-eye axis, and they have shown in experimental animal models, especially in uveitis, that T lymphocytes which are seen in the intestine or having originated from the intestine are also seen in the eye in uveitis. So that means to say the food antigens can mimic certain retinal autoantigens and can cause triggers. So this dysbiosis can induce uveitis, and I will just share with you 4 interesting mechanisms in the way it can be done. The first is what we call as molecular mimicry. So suppose you have an increase in autoreactive T cells when you have an infection. For example, this is quite common in HLA-B27 related diseases. Many of them have had a GI infection, and you see a trigger in the uveitis. And this is probably because the microbial peptides kind of react with the self-antigens and trigger immune responses. The second thing is loss of immune homeostasis. As I showed you earlier, there are these fermentative bacteria which are anti-inflammatory. And if this goes down and the pathogenic bacteria goes up, then the pathogenic bacteria actually stimulates the Th17 response, which is pro-inflammatory. Whereas the anti-inflammatory bacteria usually secretes this butyrate, and these usually stimulate the Treg cells, which are actually anti-inflammatory. So when you have a disbalance in your microbiome composition, this can also trigger uveitis. Most of the time, our intestinal barriers are non-permeable or permeable to a certain extent. But if you eat foods which causes your leaky gut, as what we say, where there is increased permeability, then these microbial products can enter through this intestine and they enter the circulation. And this can trigger immune responses in target organs. For example, Klebsiella infections can trigger, whereas you have Bacteroides or Lactobacillus. These usually stabilize the barrier. And the fourth important thing is the importance of these anti-inflammatory metabolites, especially fermentative bacteria, which secrete the end product is butyrate. Usually, if this comes down in your gut, then the chances of immune imbalance is very high. So these are the different mechanisms by which any imbalance can play a role in immune dysregulation, and this can be a basis for the triggers. So now that there is a lot of work going on gut microbiome, there are also many therapeutic interventions targeting the different areas. Now, if you look at many of our patients have H. pylori infections, and this can trigger immune reactions in some patients. So if you treat these patients with oral antibiotics, the amount of reactivations comes down with time. There's a lot of emphasis on what we call as probiotics. Probiotics are actually live microorganisms which are given in sufficient quantities. So they replace the bad bacteria, or they overpower the bad bacteria. So examples are lactobacillus, which we generally give. And so these help in a certain way to reduce this immune dysregulation. There are some things called prebiotics. Basically, these are non-digestible food materials which actually promote growth of the good bacteria, and also the diet, which I'll just come to that shortly. And many of our DMARDs and biologics which we use, such as sulfasalazine, methotrexate, mycophenolate, and even TNF alpha antagonists, they usually can stabilize the gut microbiome and play an important role in the triggers. And lastly, there is something called the fecal microbia transplantation, which is undergoing a lot of experimental work in models. And basically, you're trying to replace your gut microbiome with a healthy donor. Now, the common question which everybody asks, at least your patient asks, is what can I do so that I don't get these triggers? And one of the most important thing is your diet. So usually it is nice to tell your patients to avoid foods with high glycemic index, such as sugars, avoid processed food, red meat, because red meat and any animal protein generally kind of increases affects your gut mucosa and kind of causes disruptions in your gut microbiome. Gluten is something we ask them to avoid, and we ask them also to reduce dairy, because casein is also known to trigger mucosal inflammations. And we ask them, and the Mediterranean diet is something which we kind of tell our patients, eat a lot of plant protein, high fiber food, which are mainly vegetables, fruits, reduce the dairy, and try to avoid red meat as possible. But as you know, there's no one size which fits all. So it's always best to consult a professional who can monitor your diet according to your body type. So apart from your diet, there are also other factors such as smoking. Now, smoking is known to increase vascular inflammation, and there are a lot of studies which have shown that the macular edema goes up 5 times in these patients. So it is important to ask your patient to quit smoking. Many of our patients are depressed, they are fatigued, mainly because of the medications, and thus they become physically inactive. So it is important to ask them to work out regularly and especially do a lot of weight-bearing exercises. And physical activity also increases the decreases the white adipose tissue and reduces the level of reactive oxygen species, which actually are induced by pro-inflammatory cytokines. So these are some things which you can ask your patient to do. And in patients with HLA-B27 related uveitis, generally this helps a lot because their back is also taken care of well. Stress and sleep are very important factors. Actually, we tend to underestimate it in recent times, and this is a very nice study from Thailand which has actually looked at these factors, and they show that they play an important role on your gut health, which again plays an important role in triggering immune responses. So interestingly, when this whole thing came out, I had a patient, and I think Dr. Kwon will remember because she was his patient as well. She was a patient with sarcoid, and who used to bug me quite a bit initially with curcumin and turmeric. And I didn't pay much attention to her at that point of time, but actually she did show. And after a point of time, her reactivations came down so dramatically. In fact, she did a lot of research at Stanford, and she's also an author of many good books on tame your inflammation. And she happened to just come to my clinic one day and said, like, I would like to kind of help you with this and see if it works on other patients as well. So as usual, we looked at 50 non-infectious uveitis, and interestingly, only 12 consented to really go to her because they were desperate. And this was a very small pilot study which we did. And in this group, we had 8 patients who were HLA-B27 and 2 patients who had HLA-B27 negative uveitis, and they were more refractory to therapy. 1 patient with sarcoid, and 2 we didn't know what the cause was. And interestingly, 3 of them were already on biologics and they were desperate. I'll just take a few seconds. And they said they would try anything, and they consented to be a part of this study. And in this group, we also had 2 people who said they would refuse immunomodulation but try out all this and see if things don't recur. So they had personalized consults with her, and she basically looked at the stress levels, the food triggers. Every time there was a trigger, she would assess what type of food they ate, their energy levels, their emotions, their social connect, body weight, BP, sweating, and the sleep patterns. And I would look at the recurrences and the reduction in the dosage of these drugs. So this went on for a couple of years, and I was actually surprised because there was a remarkable improvement in the quality of life. And these patients were no longer cribbing, they were no longer dull and depressed. They felt very good. They would come with a happy face. They were more confident. They had lost a lot of weight, and they were more calm. And I was pleasantly surprised. And for me, from the eye point of view, there was a reduction in the recurrences. And 1 patient, actually, she got off all medications. And 4 patients, actually, I could reduce the dose of drugs even. So actually, what I would want to say is this is something we should not ignore. And though this is not a substitute for the drugs, this definitely gives a very added effect to many of our patients with uveitis because they improve the overall well-being of these patients. But what I find is they need a strong motivation. And one of the patients who developed a recurrence actually went back to, she just told me that she was lax in her diet and certain, yoga and certain, basically she used to do that Zigong, and she was a little lax in that, and she said, I would go back to that again. So I think sustainability and a strong motivation is very, very important. So to conclude, again, it is we cannot kind of totally rule out lifestyle modification changes because definitely it improves the overall well-being, but we still do not know what exactly is helpful for each patient in terms of the gut microbiome. So there's a lot of work which still needs to be done, but what it is safe to say is using these lifestyle changes along with your systemic immunomodulation will make a big difference to our patients. Thank you so much.